We're talking about motor system dysfunction, but this motor system dysfunction is basically like you're trying to talk about it in relation to the neurological system. Okay, so motor system dysfunction. Now, focus is to talk about motor system dysfunction, but basically the types of motor system dysfunction. All right, so we have them listed and we have few notes attached to them, and we'll be running through them. All right, so you can see these are the examples of motor system dysfunction. It could be paralysis, uh, it could be paralysis, it could be paresis. All right, so motor system dysfunction. So motor system dysfunction, we have hemiparesis, and you can see paresis is basically like weakness. All right, while paralysis is basically like an abnormal position of the body, stiffness of the body. All right, so paresis, we say that it is muscle weakness. Hemiparesis, that's hemi, half. Okay, that's muscle weakness on one side of the body that can affect either the arms, the legs, or facial muscles. All right, it could be that you have hemiparesis on the right, and your right facial muscles are all affected, all down to your right foot. Okay, that's hemiparesis. Then hemiplegia, you know that plegia is same thing as plegia is same thing as what? Paralysis. Okay, so hemiplegia, there is a muscle paralysis on one side of the body. Okay, hemi, anytime you see hemi, is half. Then the hemi, is it hemiparesis or hemiplegia? Okay, so hemiplegia is basically like muscle paralysis on one side of the body. There's not weakness, okay? There's total loss in control, okay, of the muscle. That's hemiplegia. Then paraparesis, that's basically muscle weakness on both legs. Okay, that's muscle weakness on the lower limb. That's where you have it as paraparesis. Then paraplegia, just like you know, it is not weakness, but it is paralysis. Okay, total paralysis of the legs or the lower limb body. Okay, then quadriparesis, that's muscle weakness of all the four limbs, muscle weakness in your hands, in your upper limb, and muscle weakness in your lower limb. Okay, that's quadri. Quadri means four. Okay, so paresis means weakness, right? Muscle weakness in all the four limbs. Then quadriplegia, still talking about four, but now it is pleasure. So that means there's total paralysis of all the four limbs. Okay, so under paralysis, I told you guys that paralysis is same thing as uh, pleasure. You see monoplegia, weakness in one limb; hemiplegia, weakness on one side of the body; diplegia, weakness in just the two limb, but not the total upper limb. Do you understand? Then paraplegia is weakness in the lower limb. Okay. Then quadriplegia is weakness in the whole upper limb and lower limb. Okay. So this is typical of paralysis and paresis. You can see that this paralysis, there's an abnormal position of the body. The person is stiff. There's total loss in control. While paresis, you can see she's still smiling. That means there is weakness, but there's a small control, so there's hope. While paralysis will leave you with almost no hope. All right. So guys, that's a motor system dysfunction, basically talking about the differences between paralysis, pleasure. Okay, differences between paralysis and paresis. Okay, pleasure also means paralysis. Okay, so that's it guys, and bye for now.